Okay. All right. Welcome, everyone. I will ask if you will mute yourself. You should have been muted when you entered the room. This really helps with background noise and allows everyone to have really good quality as you're trying to listen to the material. If you're coming on now, if you would just go in the chat, let me know who invited you, whether it was an invitation through Eventbrite or through one of our essential oil pages. Just let me know where you're where you learned about this and where you're coming from. It's always interesting to know how people are coming together all in one online community. So if you've been on my trainings before, you know that I have dealt a lot with grief and in my practice as well as outside of my practice. So we're going to dig into how grief affects our health. So the first thing, of course, you guys know that I always do, I want to make sure that there's a disclaimer out there because the content of this presentation is strictly for educational purposes. It's not to be a substitute for personal medical advice, diagnosis, or treatment. This should not take the place of a visit, a call, consultation, or the advice of your physician or other healthcare provider. I want you to always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition and or treatment options, especially anything that we talk about tonight. And in accordance with my Washington state license and Oregon state license, I am not permitted to offer any medical advice outside of a doctor-patient relationship. So if you're not a patient of mine, I'm not able to answer questions because a lot of times in these classes, I have people that will ask questions in the chat and I'm not able to answer those. If it's a generic question, I may be able to, I will be able to like explain the education part of it, but I can't specifically talk about your condition and how to go about treating that. So that would be something that a health provider would need to help you with. So this information is really for medical information, just educational, just to help you be more empowered and allow you to really know how to recognize certain things in yourself, family members, and when the help of an outside provider is needed. So if this is your first time here, let me introduce myself to you. I am Dr. Dolores Stevens. I have been in the medical field since around 1995. I've been a professional essential oil user since 2001. And I say professional essential oil use, and that's because I started out in my essential oil journey as a massage therapist. So in 2001, I was trained as a massage therapist on how to use essential oils. I was at that time already, since in the mid-90s, I've been a respiratory therapist, a registered respiratory therapist. And during that time, I worked in the emergency department and I also was a certified cardiographic technician, which means part of my job was interpreting EKGs and working with a physician to understand EKGs. Again, like I said, I was a licensed massage therapist, ran my own massage business. I'm now a licensed naturopathic medical doctor. A couple of years ago, our family went through some really traumatic grief events, and it caused me to step back and really look at how I had already been attracting so many people with massive grief in their life and how it had affected their health. And I hadn't put the two together until a couple of years ago, until it really hit home. And so I had a friend who was a certified grief recovery specialist, and I went through her program to help with my own grief, and I realized this was something that people needed to know about. So I went for the training and am now a certified grief recovery specialist in an advanced stage. I also love spiritual work. I love energy healing work. So I've done a lot of work with Shamanic Healers. So Shamanic Healers are healers that work within the realm of spirit. And it is just amazing to connect. I was raised as a Christian, and so it's wonderful just to bring it all together and realize that God is God is God. So I'm also a Reiki practitioner and energy healing practitioner. In my naturopathic medical practice, in my training, I had a lot of training in physical medicine. So we're talking about like chiropractic stuff, nutrition. I took 5 years of nutrition training, biochemistry, botanical medicine. So we're talking herbs, oils, all of that, homeopathy, counseling, et cetera, et cetera. Then I did some really intensive internships. I did a year in gastroenterology. I did a year in physical medicine. I did half a year in cardiopulmonary. ENT, did a lot of that. Sorry, the sound, something's happening on my computer. Nature Cure. Hold on just a second. Let me see what is, something is ringing in the background. It's almost like something on Facebook is, let me just turn Facebook off here. Didn't realize I still had it on. Okay, so I also, Nature Cure. So that is like training like old school medicine, okay? So that is learning how to use water as medicine, on and on and on and on. So in my practice, I focus on chronic viral conditions. And what that means is that I've really focused on things like fibromyalgia, rheumatoid arthritis, multiple sclerosis, a lot of things that are really chronic and nobody can really figure out why. Autoimmune disease is a big thing that, you know, my patients always complain of. Lyme disease, Epstein-Barr virus, herpes family viruses. So I focus on all those chronic viral conditions, chronic fatigue, on and on and on. GI, it's all tied in. Chronic pain, it's all tied in. Hormone imbalances, then the grief recovery, spiritual healing. It all works together. You know, we've all kind of been conditioned to compartmentalize our systems. It all comes together. We are totally body, mind, spirit. That's the only way that we can see whole healing. Anxiety, grief, and mental health, and that relationship with the physical, it's really important as I work with patients. So let's get started. Learning objectives. We're going to talk about what grief is. We're going to talk about where it becomes stuck in our body. We're going to talk about some different types of loss and grief. And here I want to go ahead and prep you to go ahead and get some pen and paper. And it just reminded me that I need to get something ready for you guys. So get pen and paper because you're going to need, there's an exercise that we're going to do, which we've never done before. So it's kind of fun to know that we're going to really dig into something new. So we're also going to talk about the way that grief impacts our health. We're also going to talk about our goal being grief recovery, and then some of the doTERRA oils and products that we can use for support. So what is happening during this time? And I love that this picture was available to me because it really speaks for kind of how everyone feels. We all kind of feel invisible right now. There's a lot of quarantine happening, a lot of isolation happening. You might live in a big city, but you kind of feel like you live all alone in a treehouse. This is a really challenging time right now. In the grief recovery world, we have seen such an increase in numbers of people reaching out for the help that we can provide. So if now feels like all of the grief that I've had in my life that I didn't even realize was impacting me I'm really kind of feeling it come all raining down on me, you're not alone, okay? You're not alone. So just know that all of the things that are happening right now, you're very much in the group of people that are dealing with this. So I want you to grab a pen and paper, and we're going to move to the next slide, which is going to give us an opportunity to look at some things. So we're going to look at a list of types of losses, because one thing that you may not realize is in the past, you may have thought that death, divorce, you know, a few things like that were primarily the cause of grief. Well, I'm going to show you a little bit more. So I'm going to show you how that you can see ways that might help you a little bit more. So I want you to grab a pen and paper, go ahead and get that ready. You're going to make a tally mark for every loss. Sorry, I was looking for part. I was going to do something for you, special for you guys, and I've lost it on my phone. So I want you to do a tally mark for every loss that you've experienced throughout your life. And by that, I mean go all the way back to the first memory that you have. If you had something happen to you that applies on this next page, just do a little tally mark. I don't want you to rationalize it and think, well, that happened, but it's because of this. Just take note of it. Just tally that grief, but don't be overwhelmed. This is just kind of taking a little bit of inventory. So this is a list of over 40 types of losses. And I'm going to give you a few minutes, maybe I'm going to set a timer. Let's go 3 minutes. Okay. So I hope that wasn't overwhelming for anyone. Just know that this was an exercise just for your information, just so that you could see that death and divorce is not the only griefs that you may have experienced in life. So keep this in mind as we move forward, because this exercise is just for your information, okay? So let's talk about what is grief. So I've got a couple of different definitions according to the Merriam-Webster, which I cannot say that I completely agree with the accuracy of their definition. A deep and poignant distress caused by or as if by bereavement, a cause of such suffering, annoying or playful criticism, an unfortunate outcome. According to the Grief Recovery Handbook, which is a handbook that I use frequently, grief is the normal and natural reaction to loss. It is also the conflicting feelings caused by the end of or change in a familiar pattern of behavior. Here's what that means. Many times after a divorce is an example I'm going to use, there may be two opposite emotions that are being felt. One being relief of the tension and strife that comes from a stressful relationship. And the opposite of that could be deep sadness for the relationship not being what you had hoped it would be. So those two conflicting feelings, which was caused by the end of or a change in a familiar pattern of behavior, that is grief. So there's many times that things happen throughout our life that cause those conflicting feelings. Anytime you have conflicting feelings, I may have sadness and joy about the same event. That is a grief event. And so when we think about that, it may feel a little overwhelming of like, wow, there are so many events that are happening in my life that are considered grief. Well, and that may be true, but here's the thing. We're going to learn some tools that are going to help as we start to recognize more of those, okay? Here's some of those feelings we may have when we've gone through a grief event. Sadness, depression is a really big one. So we may have fear, may have anger. How many times have we felt anger after something didn't happen the way that we thought it should? Or why did they break up with me? Or why did that person have to pass away? Or why did I lose that job? Why are my finances crashing? Why is COVID happening? That can also cause panic and depression. So many things that are happening in our lives are causing so many different types of emotions. We don't think about relief coming in a grief event, but it definitely does in many ways. Even if it's underlying, and sometimes it may even be something we are not comfortable speaking about because we kind of feel a little bit of embarrassment or maybe even so far as shame. So these are some of the emotions that go along with grief. What about the physical? How does it affect our body? How does it affect our anatomy and our physiology? One, during this time is what we don't want, low immunity, but it definitely does that. It also causes fluctuations in our blood pressure. So it can cause high blood pressure. It can cause gastrointestinal dysfunction. It can cause inflammation, which we know is at the root of so many diseases. It can cause chest pain. It can cause broken heart. Chinese medicine has a really unique and interesting view on grief. And this is according to the Chinese medicine text that is very, very informative. And I can't stay out of it so many times. But they talk about the emotions of sadness. Sadness gets stuck basically in the lungs because the emotional state of sadness, according to Makiosho, says it weakens the lungs. And lungs, the symptoms that occur in the lungs Could be shortness of breath. It could be tightness in the chest. It could be cough. Could be wheezing. Sadness, which can cause the lung chi, that energy that flows through the lungs. It can deplete that lung chi and the heart chi, and this can lead to stagnation. Think about a body of water. If you have a pond of water that has no flow, stagnation occurs. The water becomes not attractive. Bugs are attracted to it, but the color, it becomes murky and thick. And when this happens in our lungs, in that flow, you may feel tightness. You may have, oh, there's a typo. So you may actually feel some sighing happen more frequently. You could feel mild palpitations. So where your heart is like, it feels like it's skipping a beat or going fast or jumping around, fluttering. We call it flip-flopping in your chest. So all of that, if any of that is occurring, that could be from unresolved sadness that has weakened the energy flow in the lungs. Now, grief, which is a little bit different than sadness, but grief depletes that lung and heart chi, and over time it may result in that stagnation in the chest. You could see pale skin, you could see a weak tone of voice. Have you ever known someone that used to have a really robust tone of voice, and then now you see them 5 years later and you're like, they talk like they're so weak? That cough, that shortness of breath. Lack of joy is a different emotion, and it can cause a heart chi deficiency because we have that lack of fire. That fire in the heart is what keeps that flow going. Anger is another emotion, and it can also include resentment, repressed anger. So have we ever been in situations, just think about when you're a child and you're in a relationship with parents or authority figures that do not allow the expression of anger. They cause you to repress that. Then there could be some repressed anger in your body. Irritability could be a result of anger, frustration, rage, hatred, indignation, animosity, or bitterness. All of these are under the category of anger. And when that anger is persistent in the body, not resolved, not dealt with, then we see liver chi stagnation. And so when the liver, when that energetic flow is blocked, then we're going to see a lot of issues. We're even going to see like heart issues, because the liver is what feeds the blood flow to the heart. The liver is what detoxifies the entire body. So we're going to see so many different health concerns when there is repressed anger. And a lot of it is due to grief. But when it is very persistent and that liver chi gets stagnant, not just slowed down or blocked, it gets stagnant, then you're going to see head and neck issues, such as like headaches, dizziness, tinnitus, which is ringing in the ears. If your neck is stiff, you've got red blotches on your face or on the front of your neck. So you can see how these emotions, even as far back as Chinese medicine, they knew that sadness, grief, lack of joy, and anger would affect the manifestation in the body. So broken heart is actually a legitimate diagnosis. It's called Takutsubu Syndrome. This is a syndrome, and the symptoms are very similar to a heart attack. That could include chest pain, shortness of breath. We usually see this, and we've all known people that this occurred with, that in the first 3 to 6 months after the death of a loved one, such as a spouse or a partner. Sometimes it happens with the death of children, that the surviving spouse may pass away within 3 to 6 months. And in 1963, they did a study, and they studied over 4,000 widowers. And what they found in that first 6 months is that they had a 40% increase in mortality So 40% more of that group passed away as well after the death of their spouse. But after that 6-month period, there wasn't a whole lot of difference after that time. And then there's a recent study that shows that there's a 96% increase in cardiovascular disease, coronary heart disease, stroke, cancer, smoke-related cancers, and accidents of violence when we've had the death of a spouse occur without any intervention. And one cause of that, it is found that there is elevated cortisol in early stages after a loss. And we've talked about cortisol in a lot of our classes in the past, but we know that cortisol is that stress response hormone that when it is out of balance, and I'll talk about it a little bit, but it is released by the adrenal glands, which is that little gland on top of the kidneys. And when that gland is activated by stress, by prolonged stress, because it normally is a hormone that occurs to help us run from danger and act in ways we could normally act. But when we're in that state for a prolonged amount of time and that cortisol remains high, then it can start to have effects on our cardiovascular system and our immune system. So with cardiac, we see a change in blood pressure. So there was a study of 150 widows, and 6 months after the loss of their spouse, they had seen elevation in the blood pressure that was reported all the way up to 18 months after the loss. So the study was not started immediately after loss, but after 6 months of the loss, then the study began. And so what they found was that the blood pressure on average was over 140 milligrams of mercury. And so, normally we see blood pressures in the normal range around 120 over 80 or so, over 70 or so, but we're looking at over 140. And that's when we start looking at hypertension. 140 gets into that mark where we're like paying attention. And so at weeks 2, after the loss, they could see that there was an elevation in blood pressure. I mean, even if you just think about how your emotions are after a grief event, you're on hyper alert. Your ability to focus is off. All of these things are going on to where that your blood pressure is trying to compensate. Your body's doing all this compensation. And so that they saw that at week 2, and then even at 6 months after the loss, we were still seeing 140 milligrams. 140 millimeters of mercury at that point to where that is considered hypertension. We also, in that study, they saw that platelet aggregation was elevated in the early weeks after loss. And so what that means is that platelet aggregation occurs anytime that there's an injury. So if you get a cut or a scrape on your arm or your leg, anywhere you get an injury like that, then your platelets are going to aggregate. So they're going to come together and they're going to form a web to create blockage so that you don't lose all of your blood. To prevent you from bleeding out, your body brings all these platelets together to create like a mesh, and that is going to keep you from losing all of your blood. That's why if you're bleeding, a lot of times if it's a small cut, you can just leave it alone, your body will clot itself. That's platelet aggregation. Well, in our arteries, if we have platelets that are aggregating, coming together, forming a clot inside our blood vessels, it could actually cause things like strokes and heart attacks. So they did see that the platelet aggregation was elevated in those early weeks after a loss. So this, you can see how this is going to contribute to cardiac disease. Now, on the helpful side of this, they did also find that if there's intervention or some type of recovery or support that occurred after a loss, that there was actually a 2 millimeter of mercury reduction in that mean systolic. And what that means is, mean is kind of like an average. And the systolic is that top number of blood pressure. So that would be that 140 over 80 or 120 over 80. So they did see a 2 millimeter mercury reduction in the average mean systolic blood pressure. They also was able to see that that resulted in a 7% reduction in cardiovascular disease and a 10% reduction in stroke and death. Now, this was if there was some intervention, if there was some grief recovery or support happening. Grief also causes low immunity and a higher risk of cancer. So we talked about cortisol a little bit. We'll talk about it a little more. So the way that cortisol happens is when there is no stress happening, there's nothing causing us to feel like we need to run from the bear. We need to pick a car up off of someone. It's pretty pulsatile. It is working on a feedback system that just occurs when we need it. But when there is chronic stress happening, such as with a grief, then that release of cortisol is pretty continuous. And when that happens, it results in a reduced immunity. It also results in increased cardiac risk and hypertension, like we just talked about. The way that it really affects our immunity, though, is there's cells in our body. They're called T lymphocytes. And so these are cells that go and they kill any infected cells. So we really want them to be large in number and fighting hard for us. And what they found was that after a grief event, that these T lymphocytes were actually reduced. And so you can see why during this time, during our global health crisis, that this is really important, that our T lymphocytes are already kind of in a weakened state, and we, through stress management, we may be able to help improve those. Natural killer cells, so these are cells that work in our immune system as well, and these were elevated numbers. And when those numbers go up, so they actually work in anti-tumorous situations, and so when their numbers went up, it decreased their function. And we do see that those numbers are elevated also when we're looking at depression and insomnia. Now, inflammation, which we know inflammation causes so many health concerns. It's kind of an underlying issue that causes a lot of really common concerns we have. We love to really look at neutrophils, which is kind of a non-specific inflammatory cell. So we look at inflammatory markers when we are wanting to really see what the inflammation, the amount of inflammation that is present in the body. We're going to test the blood, and neutrophils are one of the things that we're going to look at. And we see that things like neutrophils and other inflammatory markers, they're really elevated during that first few weeks following a loss. And it can continue all the way up to a year. So I saw a lot of different numbers where some could see the return of the inflammatory markers within 3 to 6 months, but 6 to 12 months was more of the normal of how long that a grief event could affect inflammation. So our body is really slower to respond to antigens. And antigen is that first attack molecule. So let me explain this, but first just understand, before I explain it, the body's response is slower to antigens in the elderly population during the first 2 months following a loss. So this helps you see, okay, this is why then that broken heart syndrome actually occurs more often in the elderly. So let's use the common cold. When someone in my breath range, so that if they sneeze or cough, their germs are going to be in the vicinity to where I inhale them. Once I do, that germ, so to speak, once it enters my body, it's called an antigen. And then antigen is what our body looks to recognize to build an immune response against. And when our body recognizes an antigen, it launches a attack on that. And it can launch a very generic attack while the body is figuring out exactly what type of antigen it is. And then it will transition to a more specific attack on that antigen. And so when the elderly, within 2 months after a loss, are exposed to antigen, their body's response is so much slower. So this helps us know when our elderly family members and friends have just experienced a loss, we want to be able to help support them keep their immune system a little more stronger than it was before, because now we know that it's slower to respond to those antigens. It's not going to launch that attack mode as quickly as it would have before a loss. And so a lot of this helps you see, so inflammation a lot of times happens because our body doesn't know what to do with these antigens. And so the best way that it can do is just kind of like wall it off. I'm going to build a fort around it and I'm not going to let it go anywhere. Well, that's what inflammation is. It's the body rushing all of these particles to that area to try to like wall it off. And you can see here, look at all these areas of just focused redness, okay? That is an area where an army has attacked because it's trying to keep whatever is there from going anywhere it's in the body. It doesn't want it to spread to the full body. Our gastrointestinal tract is very responsive to a grief event. So if you think about how responsive our gut is just to a simple embarrassment, to fear. Have you ever needed to make a phone call that you were really nervous about? Or if you were going to take an exam, I remember taking exams that made me so nervous. I remember when I was in medical school, we had some classmates that before a big exam, they spent the entire morning in the restroom. They would be vomiting. They would have so much nausea because their gut was responding to their emotions. And these are some of the symptoms that we've seen a lot in patients with grief events. And what we know is that there's so many of those neurotransmitters in the gut lining, in the intestinal tract, that feedback loop is telling the body to overreact, because everything is kind of launched into hypervigilant mode. So we always see nausea, of course. I've heard so many times people say, when they've just learned of a grief event, of some type of a loss, think about people that, I think most of us have gone through some type of a breakup, right? And one of the first things you feel when you are like, you're realizing that relationship is not going to work, it's like, I'm sick at my stomach. I'm just sick. I can't eat. I can't sleep, because our body is responding to those emotions. Nausea is a big one. Constipation, diarrhea. We also see a lot of IBS and IBD symptoms. So irritable bowel, all of those are really hyperactive. The bloating, excess flatulence, heartburn, and even think about the emotional side when we're looking at the heartache. Think about just the word heartache, heartburn, and then that acid, that heartburn, that acid that is in the stomach, making its way up, just burning up through that tract. Think about it emotionally and spiritually, of how the body is trying to send signals for us to heal the underlying cause. We also see a lot of change in appetite. And so then we're looking at the majority of people go to, in the initial phase of a loss, we definitely see a loss of appetite, if not, or at least a decrease in appetite. And then over time, we may see that emotional compensation, to where that we're emotional eating, comfort foods, things to make you feel a little better, just to kind of help suppress some of that pain that you're feeling. So these are some of the things that we see happen. So let's talk about how to heal. It is time to heal, right? So how are we going to heal? Well, we've seen in the studies that there is support and recovery. And we're going to talk a little bit about talk support versus recovery support. If any of you have ever been in talk therapy type setting, you know that it didn't seem to be as helpful as you may have hoped. Because when I go into a setting where there's a group of people and everyone has experienced grief, it almost becomes a who can give the worst grief story. And that is not usually helpful. We've seen in studies that is not typically the type of support that actually provides healing. And we know it's never too soon to heal your heart, right? So we're going to look at ways that provide some of that support so you can. So because we know, we've talked about how the cortisol is very elevated. Our sleep is not very good. Those immunity markers are off. But we have seen studies that show that through support, the right type of support and intervention, that you see a lowering of the cortisol level, that sleep is improved, and that those immunity markers improve. There was something I was about to say and I lost the train of thought. So sleep is a really big healer. So I want to talk about sleep for just a minute, because we know that sleep tends to return to normal within 6 to 12 months after a loss. But one thing I want to ask you is, if you broke your arm today, how soon would you seek help for it to heal correctly? Would you wait 2 months? Would you wait 6 months? Would you hold that broken arm in an awkward position for 6 months because you're like, I'm just not ready. I'm not ready. I can't handle them touching my arm because it's too painful. I can't handle it. I've got to wait a few months until I can handle the pain of someone stimulating that arm. Yes, my Aunt Wanda says, go to the ER immediately. Exactly. That's exactly right. You go to the emergency room immediately. You get help immediately. But when we break in emotions, when our heart is broken, we think we have to wait months before we're able to stand the pain of someone helping us recover. So I want you all to really think about, our emotions are just as important, if not more important, than our bones, than our ligaments, than our muscles. We deserve to start the healing immediately. We're going to talk about some oils and supplements that I love to use for that healing process, okay? And for those of you that know me, you know that I have done extensive research on essential oils. And many years ago, I did tons of research once I learned I was going to be able to use oils as medication for patients in my clinic. Then I did extensive research to find out the company that would provide me with the safest and most pure oils on the planet. And in that research, of course, I came with doTERRA, and I have worked with them for many years now and have had tremendous results. And I love using them in the spiritual healing work and in the emotional healing work that we do in the clinic. It's just amazing. So first I want to talk about, this is a program that I use that has, this is the program I told you about when our family went through that grief event. You know, we needed some support. This is the support that we got. the grief recovery method is an evidence-based program. And it moves you from discovery, which I'm going to share a little bit of that with you tonight, to recovery. And so it's been shown to be an evidence-based program that can actually make a difference for those dealing with that emotional pain of loss. And so Dr. Rachel Nolan from the Kent State University, she worked with some other doctors, and they actually published a couple of articles in the American Journal of Health Education, and it did show that the participants that went through this program that it was a very effective program for grievers, no matter what the loss. And you saw in the beginning, there's so many different types of losses that occur, that any of those losses, whether they seem to you large or small, that this is a very effective program. And I can speak to you from experience. I went through the program as a participant twice before I went and was certified and got the training to be able to offer it to others. So the part of the discovery part of this is that we have been taught incorrectly about how to handle grief. We've been taught 6 myths. Those myths are don't feel bad. So we're taught that we're not supposed to grieve. And an example of this with the next one, replace the loss, is, well, don't feel bad. First of all, let's talk about divorce. Because a lot of times divorce is where we hear things that don't make any sense, like over here on the right, you are better off without them. And what a relief you must feel. Well, you know, that might be correct information. It might be incorrect information, but it's actually telling us not to feel bad, that we are not supposed to feel the grief of losing a relationship, of any type of loss. Well, you're better off without that job. You're better off without that car. You're better off without that boyfriend, that girlfriend, that husband, that wife. We're also taught to replace the loss. Get over it. Move on. You know, you're better off without him. Go ahead and get another guy. Your dog died. Let's go get you another one. We're taught to replace that loss. We're not taught to deal with it. We're also taught to grieve alone. How many times did you hear in your life, if ever, when you were a child, even if you're going to cry, go to your room? Okay. Things like that we don't think about. Oh, I'm actually taught to go to my room if I'm going to cry because my family doesn't want to see that. I hear that a lot from people that have heard that as children. And we also told that it just takes time. You know, time heals everything. No, it does not. It does not heal everything. If I broke my arm today and I wait 6 months or I wait 6 years, time is not going to heal it. It will put the bones back in a position, but not correctly. It will not heal it. It will not bring it back together. We're also taught to be strong for others. We're also told sometimes God won't put more on you than you can handle. And even though that may be true, it does not help. It does not tell us that we can be grieving in this moment. We don't have to be strong for everyone. We're also told that we need to stay busy. Just stay busy. Just go back to work. And you guys are hearing my dogs. They're a little crazy. We're also told that if we just stay busy, then go back to work and work through the pain, then we will not feel the pain when we know that that does not happen. We know that there's correct and incorrect information that we may hear, such as like the good die young. Well, we don't really even know if that's true, but some people say that in the moments after a grief event. You're better off without them. What a relief you must feel. They're better off. They're in a better place. Think about yourself. If you're that griever and you're hearing that they are in a better place, do you really care if that's true? Your heart is broken. It doesn't make any difference. So just know that this is some of the recovery portion of that program that I work with. Now let's talk about some essential oils that are really helpful during grief support. Breathe is my favorite for this. This is it right here. I've got it going in this diffuser beside me. It is amazing because it is the oil of your breath. And remember, Chinese medicine says that grief, sadness can affect the lungs. It can get stuck in the lungs. It can cause that lung flow of energy to be interfered with, where that we're not able to have the lung function happening as we need it to. It assists that inability to let go of grief and pain. So breathe oil is amazing for this. I love to work with patients and with grievers that need something at home, just to help them let go of the pain as they're working through this program. Deep Blue is another beautiful oil. It's the oil of surrendering pain. It assists those that are resisting or avoiding emotions, and we all have those. Sometimes as we go through the grief program, people don't even realize some of the emotions that they had from an event that happened in a childhood event. Geranium is the oil of love and trust. It does facilitate trust. It aids us in healing the broken heart. Those suppressed emotions of grief or anger, geranium is the emotional healer. Lime, it helps, it is the oil of zest for life. It helps to cleanse the heart of any buildup, because emotional toxins, they can really interfere with our joy. So lime really helps our emotional state provide room for that light and joy in our life. Ylang ylang. This really is a beautiful oil when we're looking at childhood trauma, childhood grief events, because it is the oil of the inner child, and it's a very powerful remedy for the heart. It assists those in when you're trying to assess your intuition. So it really helps you gauge that and know when it's speaking to you. Emotional trauma from your past and buried emotions, it really helps to release that. Aroma Touch, this is a beautiful blend. It's the oil of relaxation, and it helps that stiffness in your heart. It helps move that stiffness that's in the heart and the mind to more of an openness and flexibility. Manuka is a beautiful oil. It is the oil of being upheld. And how many times when we're going through grief do we need to feel upheld? It helps with healing wounds, and it soothes troubled hearts and nurtures souls and transmutes suffering into transcendence. Because it raises your vibration, it raises your awareness. When you're more aware, you're able to heal at a deeper level. And then here's one of my favorites for grieving people, which we all are grievers, Console. It is the oil of consolation. And I know that there's a lot of times that when people are going through a grief event, they're very averse to consolation. And so with this one, I'm really careful when I introduce it to someone in their path, but it does help to soothe emotional pain. If they're burdened by loss, grief, or a tragedy. Siberian fir is wonderful. It's the oil of aging and perspective. So if we think about, if we're dealing with a grief event as we're young, it's not the same as when we're older. We've got more different perspectives. So it offers that comfort and support during all the losses. DDR Prime is one of my favorites. If you've ever been in one of my classes, you know I love this oil. It is the oil of transformation, and it helps the body return to balance and the emotions return to balance. So these are some of my favorite oils for grief. And you can see up in the corner the emotions book that I love to use for reference. All this information came from there. So also Desiree Mangadog, if you guys are familiar with her, she's got some amazing blends that I've loved to use with people in their process because there's blends for letting go, for inspiration, for the heart, for the mind, abundance blends, empowering, feel-good blends, blends for hope. Because when we're dealing with emotional healing and dealing with past grief events, this is really important that we've got the tools that we need as we go through this process, because what I've seen happen is the oils are amazing in working with a person as they're feeling all of these emotions. What it does, it allows us to actually embrace the emotions, process them, and move forward, where in the past, we may have suppressed them and pushed them down. And so grief support, we know that during grief that our health is very much impacted, right? So we have lower immunity. So in doTERRA, we have this amazing set of vitamin, minerals, antioxidant, and omega lifelong vitality. And whoever invited you to this class, or if you learned about this through Eventbrite, get in touch with me. I can help you know more about this. And the person that invited you here can do that as well. But this lifelong vitality, when I was in medical school, my physician introduced me to this and prescribed this for me. And I became obsessed with finding a better vitamin mineral complex and antioxidant formula than she had me on, and I could not. So this is top of the line to me. Just make sure that anyone that's going through a grief process is very well supported with lifelong vitality so that all of their immune function is working in optimal form. DDR Prime, of course, comes in a soft gel down here in the bottom, so you can take it internally if you need to. I love it in the oil form. Got it right here. I love to put it on the bottom of my feet. You know, I like to do like 8 drops of it on the bottom of my feet, rub my feet together because it's got amazing oils in it. I'm going to tell you all about that in a minute. On the far right corner, lower hand corner, Max. And so you may think, well, this is the energy and stamina complex. Why would I need it during grief? Because remember we talked about cortisol, how cortisol is definitely affected after a grief event. So our adrenal glands need a lot of support during that time, wouldn't you think? Well, that's a lovely thing that Max can do for us. It's got a beautiful herb in there called ashwagandha, which is an adaptogen. So that's going to help to balance our adrenal glands as we're going through this grief event. In the upper right-hand corner, adaptive. This is a system that you see here. I love the oils. I love the complex. That formula is magic. I take it every day. It's got GABA, it's got scutellinium, it's got ahi flower. All of those, what they do, they work with the brain. They provide us with a neurotransmitter that helps our nervous system stay calm. It really helps the brain. Our brain needs GABA. We're deficient in it a lot of the times, and those herbs work together with that neurotransmitter to balance that GABA and glutamate seesaw that happens in the brain. So it really helps with our stress response, because when we're in a grief event, we're going to feel the stress. So we need something like adaptive to really help keep that stress response a lot more balanced so that our body doesn't respond with that high fluctuation of cortisol. Then we have Copaiba. This is a beautiful oil blend on the left, and it's in a soft gel on the right. This oil is from a tree in Brazil. It acts on the CB2 receptor, so it acts like cannabis. So it acts on the same receptors that marijuana acts on, so that it provides our body with the stimulation to relax and lower a stress response. So before anybody asks, it does not in any way, it's not in the same family as cannabis. It doesn't have the same effect on the psychoactive. It only acts on the CB2 receptor. And so that is the receptor that provides us with more calming and muscle relaxant. So it allows us to feel that stress reduction and lessen anxiety. So it's a beautiful oil that works during the time of grief. Zendocrine is a oil and a complex that I want to talk about, because it is the oil of, it's not transformation, I just lost it, but detoxification. So it's the oil of detoxification. So it helps us as we're releasing emotional toxins. So think about if you have held on to some grief for, I'm 54. If I've held on to some grief since I was 14, I'm going to say, I'm making up a number, and I held on to something since I was 14, do you think it has some emotional toxicity to it? Yeah, it does. So this oil is beautiful. You could diffuse it in a blender. You could put it on your body. You could take it internally in the soft gel, but it really helps to like shed with that apathy, to find that enthusiasm for life again. And then down here in the bottom, the complex, because remember we talked about how anger can affect our liver. Well, this complex is a liver complex. This is detoxification complex that is amazing to help our liver, as it has been bombarded just so much with all these toxins that it's having to like try to process from the emotions. So it's got barberry leaf, milk thistle, burdock, clove, dandelion, garlic fruit, red clover, Turkish rhubarb, psyllium husk, acacia gum, marshmallow root. Oh my gosh, I love marshmallow root. Osha, one of my favorite herbs, safflower petals, and kelp milk. So these are all of the wonderful herbs that are brought together in this complex to help with our liver as it is processing grief. Let me get a drink so I can tell you about DDR Prime. DDR Prime, oil of transformation. So as grief has really done a number on our body, physically, spiritually, emotionally, DDR Prime, which you could say damaged DNA repair, you could say resonance, you could, you know, whatever. It's a way to help your DNA recover from the emotional toxins that have had the physiological effect. So it has a lot of my favorite oils in here. It's got frankincense, and we all know frankincense is the king of oil. This oil helps our body's healthy response to free radicals. So we know, because that is a big cause of a lot of inflammation, our immune system to drop. It's got wild orange that helps our cellular response. It's got litsea. I love litsea. It's oil manifestation. It helps promote healthy cognitive function. And we know this for sure. When people are in an acute grief state, their cognitive response is really low. So like when I'm working with a griever and we're in the grief recovery program, there's assignments. So they have reading assignments, but I know that their cognition is very impaired. And so if you ever read a paragraph like 6 times and you're like, I still don't understand what it is, then you may be a griever, because that is what we're looking at. We're seeing that this cognitive function is very reduced in grievers that have unresolved grief. Thyme, it's amazing for the immune system. Clove, powerful antioxidant. Some are savory, oxidative stress as well. Nauli, it's about immunity. Lemongrass, environmental threats. These are all oils I'll use a lot of, so this is one of my favorites. And then oil application. So you guys know I use a lot of Symphony of the Cells. So Aroma Touch technique is another application that is very, very beneficial. Of the Symphony of the Cells, I would use like the Chi protocol, the Emobic, which is a blend between emotions and limbic. Forgiveness, purpose, respiratory even, because remember, it gets stuck in the lungs. You could use the detoxification one, sensory and solar. So these are all things that are really uplifting. I would say be very careful using the forgiveness without full preparation. And if you are looking at using the forgiveness on someone and you're not really sure how to use it, then get in touch with Symphony of the Cells and find out a little bit more about that, because it's one that you want to really know what you're doing. These are the references that I used. I'm just going to put them out there really quick for you to look at if you want to take a picture of it. These are the studies that I looked at. One was primarily a meta study, so that is a study of all kinds of studies. So that was a really big study I looked at. So whole healing is what I do. The grief recovery method is the program that I use. I am an advanced certified grief recovery specialist. This helps to resolve incomplete grief. My job as a grief recovery specialist is to help guide you in the steps to completing unresolved communication, because that's what we know is the cause of that unresolved grief. It addresses known and unknown trauma. The grief recovery program, it is online now only. It's very individual and it's very confidential. Now, I've had a lot of you guys contact me about being a patient of mine. Just know that we are working on a format that in probably about mid-August, we will have online consults ready for you guys. So here's my contact information at the bottom, drdoloresstevens@gmail.com. And here is my scheduler if you're looking at scheduling. You can schedule a 15-minute free consultation with me. You can also schedule, if you're wanting to look at essential oils, you can schedule that as well with me as well. So let me see. So I want to open it up for some questions if we can do that. What was the name of the grief program? Oh, here it is right here. So the grief recovery method, it is based in Oregon. And I was actually in Oregon when I learned about it. And so I was really blessed to be able to find this and be able to work with people. And I will tell you, it's a program that has just blown my mind. I did, when my practice was in Portland, I did group sessions at the clinic in Portland, and we had just amazing results. And I'll tell you guys, what I saw was I saw people that had grief, unresolved grief as patients, and they came through this program with a group, and by the end, they looked completely different. They held themselves completely different. One lady told me, she said, during this program, I learned who I really am and why I've acted the way that I have in the past, and how I can now hold my head high and know that I don't have to answer to anyone but me. And that made me so proud to know that she had that response. So someone says, what would be the best oil for kids that are dealing with trauma and high SI and HI? I'm not sure what those are. If you want to tell me what those are. But oils for kids, I will tell you that the kids can use the same oils that adults do. So what I would recommend is looking at either Desiree Mangadog's book or the Emotions and Healing book, and find what really resonates with the, so one thing, so this Emotion Healing book, it has in the back of it, it's called Essential Emotions. It's the 8th edition. And in the back of it, it actually has some emotions. And you can look up that emotion and it will tell you all of the oils that work with that emotion. So let's say this, let's say there's a kid that they are dealing with trauma and their primary emotion is anger or bitterness or depression or whatever their emotion is, then you can find something that works on that level. Console, remember I said Console, I love Console, but I use it very respectfully of the process. So I would not usually start someone out with Console, because first we want to get into a place where they will accept consolation, because like I said, a lot of grievers are averse to consolation because sometimes consolation can feel like suppression. So others need it. So it's just about knowing who you're dealing with. So that's what I would say. So I'm going to do this though. Let's go back up really quickly to the list of oils for grief support. So in relation to that question, breathe, I'm always about some grief. So if you look at trauma, people that are experiencing trauma, one, they've lost trust. They're dealing with pain. And a child especially, you know, ylang ylang is the oil of the inner child. It helps, you know, heal the heart. Geranium, that emotional healer. And so in any of the oil leaders that are on this call that have any input as far as your personal experience, I welcome you to jump in and say anything that you want to. But just know that using the oils in the safest way, such, you know, using them in a diffuser, using them gently, and there's a lot of oils too that children have, we have kids oils in doTERRA. Prince Gray says, some of the symptoms you mentioned from heartbreak, could they also be an awakening from a spiritual standpoint? Think a moment. Definitely, from a spiritual standpoint, because when you're awakening from a spiritual standpoint, it is kind of like a jolt, and it can feel like that push, especially if there's resistance, is what I'd say. Would it, there would be resistance to that spiritual awakening. And so there can definitely be some physical responses that happen when someone is working in that trying to awaken from a standpoint when you're trying to get ready to move, and if there's a resistance there, then the body will really respond in a way to try to get your attention to the heart. And so could those symptoms be indicating of that? Yeah, they could. There was another question, would it benefit the clinician if the clinician had the smell of it to calm the child down to be able to open up? I mean, I love clinicians working with kids that will have oils diffusing in a room, or at least to have it available for a child to smell. What I would probably think about is, if you're the parent or the caregiver of a child that is in with a clinician, to allow the child to have the oil with them and allow the child to be empowered by using it how they need to use it. So an example, my grandson, Aiden, is he's very knowledgeable about which oils really call to him, and they allow him to know what oils to use when. And so when we give children that empowerment to choose the oil that they feel the best with, and then we empower them to use it during that grief process as they need it. And yes, sometimes they're going to need a reminder, but to allow them to have that empowerment of having the oil in their hand, using it as they need it, then that opening up will happen organically, because we don't want to try to use an oil to push a child to open up before they're ready, because people shut down for a reason. Why we shut down? There is a loss of trust. And if someone tries to use anything to make someone open up before they're really ready, so when you say that, I really think that there's a process that's needing to occur before that. That makes sense. Okay, so yeah, somebody said I wouldn't have guessed that there were 20 plus types of grief. There's 40 plus types of grief. Isn't that something? Okay, all right, let's see. I'm going to copy some of this. Some people are throwing in some information I don't want to lose. Okay, any more questions really quick before we end? Okay, I hope you guys grabbing all of this information. And again, make sure that you have my contact information, so that if you want to go through this grief recovery method with me, I do this online. I do this, it's very confidential. It is very beneficial. I've never had anyone want their money back or say they wish they hadn't done it. It's always been very, very helpful for everyone that's gone through this program. I know for myself, it was life-changing. For my partner, it was life-changing. It has just been a very wonderful program, and I love that I'm able to share it with others. Okay, let me check the chat. There's a bunch of comments going in. Mentioned being careful with forgiveness. Why? Great question, Jennifer. So forgiveness is very powerful protocol. So forgiveness is a symphony of the cells protocol. It is very powerful. And even as you're reading, it kind of helps you prepare for it. So what I did is I worked with someone that that needed the forgiveness protocol done. But in preparation for that, what we did was we did the emobic protocol for a few weeks prior, and we were doing a lot of counseling and spiritual healing work with her, preparing her for that. And here's why. Not everybody is ready to forgive, right? Because what we know is that sometimes the pain is too severe to say the word forgive. Okay, so the word might actually be, I acknowledge the pain that you caused me. It doesn't mean that I'm going to forgive you. And so it allows time to find the right timing for the person that is able to accept the forgiveness protocol. And it still doesn't mean that they have to say those words, okay? Because we've had a lot of misteaching on that, to where that we hear people say, oh, you know, I actually had a friend of mine tell me, say, you just need to find a way to forgive them. And me being a grief recovery specialist, I immediately said, no, I do not. I do not have to find the way to forgive someone. I have to do the grief work, and I have to dig into why this is causing me to react the way that it is. And I can acknowledge that their actions are causing me pain, but it doesn't mean I have to actually forgive. Somebody was asking about the books. Let's look at those books. So here is, thank you for Denise for sharing that. Oh, I didn't have, oh, there it was. Up in the corner, Essential Emotions, and I Am Fabulous. Okay, any more questions before we go ahead and, we're gonna go ahead and call it end of class. I appreciate everybody. You guys always make this so much fun. You know that this is my passion, is teaching about things that I have been blessed to know, and all this knowledge is just mine until I can share it with you guys. So thank you all for attending. Have a great night, and we will see you guys in a month for the next education series. Thank you, everyone.